Hey there, this is Cassie Cannon of Cannon Psychology, and today I wanted to talk to you about phase 2 of EMDR's 8 phases. Phase 1, as you may have read or watched my last blog, is history taking and treatment planning. So once we have completed an assessment, history, and created a plan as to where we want to go, what we want to do, what's bothering you the most that we need to tackle first, then I'm going to actually prepare you for the experience of EMDR. And preparation takes as long as it takes. And there's no set length of time for preparation. It really depends on the person. Some people it takes a session or two. Other people it may take multiple sessions or a month or 2 or 3. Really depends on the person. Some people could be in the preparation phase for a few months. I've heard of other people in the phase for even longer. I've yet to have that experience yet. But I don't doubt that there are some people who need a little bit more time to prepare depending on their unique situation and how comfortable they are. But preparation involves me explaining the mechanics of EMDR, us identifying, do you work better with eye movements? Do you work better with buzzers, auditory? We discuss the importance of staying within what's called your window of tolerance, meaning you're not so overwhelmed that the processing isn't helping, but not so underwhelmed that we haven't accessed the memory that we're working on. We talk about, stop signal. If you are feeling overwhelmed and you need to stop, you let me know. I always tell people, I need to know that you want me to stop the actual EMDR, because sometimes if someone's processing a memory where they were asking the perpetrator to stop, I don't know if you are actually acting out part of the memory or if you really want me to stop. But people are really good at telling me I'm ready to stop. But to be honest, I would rather you tell me when you're starting to even feel anxious to the point where you're starting to get nervous, because I don't want you so intensely activated that you are feeling really scared and anxious. I want you a little bit lower than that. So we talk about trauma memory storage. We talk about how we take a memory that's been stored incorrectly and how we actually reprocess that into long-term memory so it doesn't have the same amount of energy that it once did. And then I also really want to answer any questions and all questions that you have. It's more of an informed consent. I want you to know what to expect. You may have heard a lot about EMDR. Everyone who does EMDR has a different experience as a client, so please don't compare yourself to someone else, because their experience will be completely different, and it doesn't mean that your experience is any less valid with EMDR. It's just your brain goes where it needs to go, and it does what it needs to do, and it knows what to do. I also like to get people set up with some good, strong coping skills for the process of EMDR. Some people might dissociate a little bit more than others. Dissociation occurs when we feel a little bit overwhelmed, and it's a protective mechanism of our brain, and it can kind of cut us off from what's going on. And then there's also really normal average levels of dissociation. For example, you can dissociate or get really absorbed when you're watching a movie or a video or your favorite TV show. You can dissociate when you're driving to work or driving home from work. Those are kind of natural, common levels of dissociation, which we all do. Some people dissociate a little bit more than others, and so I'm in my preparation and in my history taking phase, I'm assessing your level of dissociation and how much prep we need to do, like to figure out what are some good grounding techniques for you. And in and of itself, dissociation isn't bad. It's just something that happens to us at times, and I don't want you so dissociated that you're not having any benefit from the treatment. So we talk about that in your unique case. Two specific things I like to make sure everyone has ready to go is something called the container exercise, which is kind of a fun exercise where we put all of the memories that we're going to be working on in a container to the side for now, and we take each memory out of the container and we process one memory at a time. So if we're in the middle of a memory and a new memory kind of comes up, we just put it in the container and we address it later. If we don't finish a memory in a session, we put it in the container so that the next time I see you, we take the memory out of the container and we continue to process. And then another thing that I like to make sure people have ready to go is a calm, I call it a calm place. Some people will call it a safe or secure place. Some people don't like the phrase safe place because no place can be actually safe. According to some people, it kind of depends on if someone's in the military, they might really not feel like any place is actually safe, but we can make it as secure as possible. So you might hear different terms for the safe or the calm place or the secure place. I like to call it the calm place, and that's a place that you can kind of go to when you need a place to feel like calm and grounded. And you've probably done an exercise like that in the past, and EMDR, we just kind of enhance it a little bit with bilateral stimulation. Ultimately, when you feel ready and I feel like you're ready, we then start processing memories, and that is where phase 3 comes in, which is called the assessment phase. That's activating the memory. And then phase 4 is when we actually are processing the memory. And phase 3 and 4 happen in the same session. I typically won't start processing a memory if we just finished prep. So I'm not going to do prep and then start processing a memory in the same session. I like to give people time in between sessions to kind of really absorb the things that they've learned. I hope that makes sense. I tend to ramble, but people tell me usually that it has made sense to them. So if you have any other questions, though, feel free to email me through my website, and I'm happy to get on the phone with you and answer questions that you have. Anyways, thanks so much.